Welcome to Get the Facts. My name is Suzanne Bernier Robinson. Today we are going to be learning about stroke. I have with me here Chuck Hemian. Chuck is the Director of Emergency Medical Services with the Derry Fire Department. Welcome, Chuck.
Good morning. Thank you for having me. And I'd say thank you for bringing attention to stroke, because that's of grave concern for our citizens and our residents. Stroke, last year we had 120 responses to stroke-like signs and symptoms. So it's a major concern. So educating the public, I think, is hugely important.
Thank you. That is a lot of services or calls out for just specific stroke symptoms.
Stroke.
Wow. Well, tell me a little bit about your position first here with the fire department as Director of EMS.
I'm the EMS Director. I was actually in Derry in the early 1980s. I was amongst the first paramedics here in Derry. And I was in service here in town for about 10 years. I actually left for 20 years and was off consulting and teaching. And I had an opportunity to come back to Derry. And Derry is that one community and one department that I have always had the greatest respect for. Great opportunity, came back, and I've been here for close to 10 years again. So this is what I do, and this is what I know, and this is what I love.
Well, I know you're very knowledgeable about the symptoms and signs of stroke. So first of all, tell me, what is a stroke?
Well, a stroke is a brain injury.
Oh, it is. Okay.
And a brain injury caused by typically one of two things. One, interruption of blood flow, and a lot of times it's some type of an occlusion or a clot. And the other is bleeding in or around the brain itself. So it's either an occlusion or some type of bleeding that leads to some type of brain injury. Some real interesting facts about stroke. A major blood vessel in your brain that's obstructed, each minute that it's obstructed during stroke, about 1.9 million brain neurons die.
Wow.
Or about 120 million brain neurons per hour. We recognize stroke as now the fourth leading cause of death. It used to be the third, now it's the fourth. COPD has moved into the third space, but still a high percentage of people that have stroke. We know that about every 4 minutes, someone in America dies from stroke. Stroke kills twice as many women as breast cancer does every single year.
Really? Okay. So it's not getting the attention that it really deserves.
Well, they've done a great job of talking about cardiac disease and heart disease. And learning CPR and cardiac arrest in the pre-hospital world. And we need to do a better job of educating the public about stroke.
Brain attack also, is that just a nickname for stroke, or?
Well, it can be considered a brain attack. If you think about what's going on in your brain, your brain requires a constant, steady flow of oxygen and nutrients. And if we have some type of obstruction in a blood vessel, we're no longer supplying that brain tissue. 5 minutes of obstruction, that means a stroke that's going on for 5 minutes. We're going to have some level of ischemia, which is a lack of oxygen into that brain tissue. And your brain needs oxygen and it needs nutrients. So a mere 5 minutes, we have some ischemic changes to the brain. And it just tends to grow and grow and grow until that stroke can be treated. So it's about early recognition, early activation of emergency services, and early treatment.
Okay. So what are some of the symptoms of stroke?
Well, patients can present in a wide variety of ways. Patients may have a very acute onset, and it tends to be very acute, where they may have some facial asymmetry, where they may have facial droop on one side or the other. And we'll typically ask them to smile, to stick out their tongue, and to try to frown. And you'll actually see one side of the face looks normal, the other side tends to be drooping. We ask them to try to speak a sentence. And I might use something, for example, like, "You can't teach an old dog new tricks." Now, some people having strokes have difficulty, understanding speech, and others have difficulty making speech. So imagine how frustrating that must be for a patient. You can understand what I'm saying.
Right.
You can't make the words.
Right.
And other patients will have some motor weakness, and there may be a significant deficit on the right or left side. It could be minor. And they have some cognitive deficits to the point that they may not recognize that they're having an emergency. It's typically observed by a caregiver, a friend, a family, a peer.
Oh, really?
They may not immediately recognize it.
So it's not like a sudden feeling of pain that may be associated with it. The symptoms may be so subtle that you wouldn't notice it.
Some patients that have the hemorrhage type of stroke, which is actually a very small percentage. Most of the strokes that we see actually are a result of blood clots, and it's some type of an obstructed blood vessel. Those that have some type of hemorrhage, it's not uncommon they'll have a significant headache or severe headache. Or if I hear, this is the worst headache I've ever had in my life, that's of concern. But most patients that have the obstruction type stroke, an obstruction in that blood vessel, it happens very acutely, and then they start to show some signs and symptoms.
Okay, so it may even go unnoticed a little bit.
It could go unnoticed by the patient until they're recognized by a family member, because they have these cognitive deficits. They really don't recognize what's going on.
Right, right. So can someone experiencing a stroke have just one or two of those symptoms and not all of them?
You could have a wide variety from maybe just the face not looking normal, maybe just a little bit of difficulty with speech, maybe just a little bit of motor weakness, or they could have complete paralysis on one side of their body. So it presents differently for a lot of people.
But it's the symptoms sound a lot different than a heart attack. So is there any
Well, that's where we hear the term brain attack. Because when you think about what a heart attack actually is, most commonly a heart attack is a blood clot in one of the blood vessels in your heart. We call that a heart attack. Well, when we have a blood clot in your brain, you can consider that to be a brain attack.
That makes a lot of sense.
It does. It does.
Are there symptoms the same for men and women?
The symptoms are pretty similar for both.
Okay.
Interesting, men are at greater risk than females.
Oh.
And the first male, typically we see them when they have their first stroke at around age 68. In females, it tends to be out to like 72, 73. However, I'm sorry to say this, but women have more severe strokes.
Wow, okay.
And that if we look at morbidity and mortality from stroke after a single month, I would tell you that females have about a 25% chance of death from stroke after 1 month, and that males are probably at around 19%. So we tend to get them a little earlier, 68. Right? Females tend to get them a little older, but they're typically more significant.
Wow, that's interesting. What are some of the warning signs then? You mentioned the symptoms. Are there any warning signs that, that you may be having a stroke?
I think what's real important is that you have a conversation with your healthcare provider. I think when we consider the risk factors, because you really can't prevent a stroke, but what you need to do is address the risk factors. You need to become educated. For example, cigarette smoking probably increases your risk of stroke by 50%.
Wow.
So quit smoking. Could really extend your life. We know that. There's enough evidence out there to support that. Two patients that may have diabetes increase their risk. So you'd want to have tight glycemic control. You want to keep your blood sugars in check. If you have hyperlipidemia, high cholesterol and such, you want to keep your cholesterol. And they find that patients that take statin medications probably decrease their risk as well. Patients that have an irregular heart rhythm, something called atrial fibrillation, and they're not treated with blood thinners, they increase their risk of stroke pretty significantly as well.
That makes sense.
So it's one of these things that you want to have that conversation with your healthcare provider. You want to understand what your risks are, and you want to try to modify those potential risks. We can't adjust our age. We can't adjust the fact that we're males, that we're potentially going to have strokes, but there are modifiable risk factors that you can get control of and decrease your risk of stroke.
That makes a lot of sense. So are there statistics out that like 1 in 5 women will experience a stroke by the time they're 75, or any figures like that out there?
I would tell you that it's the 4th leading cause of death, and it kills, again, and I mentioned earlier, twice as many women as breast cancer. We do bring a lot of attention to breast cancer.
Right.
We don't bring that same level of attention to patients having strokes.
So it's pretty high.
It's very high.
Yeah. Well, when you have a statistic like 1 in 4, you start looking around, okay.
I'm in a room, and there's 2 of us potentially could be having a stroke. That's
right,
very true.
Exactly. So I've heard about like a mild or a mini stroke. What is the difference? Is it just the severity of the clot, or?
Well, one of they call a mini stroke, and they're called TIAs. They're called transient ischemic attacks. And typically you have a blood clot in your brain, but it's going to resolve itself. And you typically do not have neuro-like signs and symptoms. For example, you may have some facial droop, you may have some motor weakness and speech difficulty, but it doesn't last beyond 24 hours. If it lasts beyond the 24 hours, then they consider it a focal stroke. If it dissipates and you return to baseline, normal, in less than 24 hours, we call that a TIA, or a mini stroke. And one of the things about a mini stroke is that when you start having a lot of mini strokes, you're probably in line to have a full-blown stroke.
Right.
And careful management by your healthcare provider
can help with that.
will help with that.
Is there medication that you would go on if
Well,
you had had a number of mini strokes?
Again, I think it's really looking at the risk factors.
Okay.
And they're going to treat the patient
Yeah,
accordingly.
maybe
They
what is
really just
causing it.
need to modify those risk factors. We probably can't prevent it, but we can at least modify those risk factors.
Right. So if someone is feeling like they're experiencing a stroke, or you notice somebody whose mouth is drooping and you've asked them a question and they're having trouble understanding or repeating or giving you an answer, I imagine to call 911 would be the first thing.
Absolutely.
First thing to do. But is there anything that we should do while we're waiting for help to come?
We have a very short window of opportunity to treat these patients. We're talking less than 4 hours. And when I look at it from the EMS perspective, that's really about 3 hours, because by the time we get them to the hospital and they're able to do the testing to include the CAT scan, that takes 45 minutes to an hour before they can decide whether or not they're going to use the treatment or not. So anyone that recognizes a patient that may have facial droop, speech difficulties, motor weakness, and they at all suspect stroke, immediately call 911. Don't call your primary care physician. Don't call the emergency department. Don't try to call the secret squirrel number at the firehouse. Call 911. We work closely with 911. They take all the information. They actually give us information and instruct us how we should respond and what we should respond with.
Right.
So if we know we're going to a stroke, we're going to send typically an engine company as well as an ambulance for all those resources. We put our best foot forward to take care of the residents, the businesses, and the visitors of Derry. They're going to get our best service.
Well, with the way you just described it, I've heard the term FAST associated with stroke. What does that acronym stand
FAST
for?
is really, if you look at FAST, has to do with face. And again, I
Okay,
talked
so
about
look for
symmetry
those
of the face, some
facial.
facial drooping.
Okay.
And next would be some maybe arm or motor.
Okay.
So we call this motor weakness.
That if they can't hold their arms at the same level, or if you put
Correct.
a little pressure.
So I would have them close their eyes and put their arm out, and this to me would be significant, a little bit of arm droop. May not be significant to the patient with their eyes closed, but that's a little bit of motor weakness.
Okay.
If they're having difficulty with speech, and again, it could be difficulty either expressing speech or understanding speech.
Okay.
And then the most important aspect is time. You call 911 as soon as you make that recognition. Again, it's not any other phone number other than 911.
Right.
We send out all the resources. We do that quick evaluation, and we transport you to an appropriate stroke facility.
Right.
Now, most of the hospitals in New Hampshire are stroke facilities. Well, what does that mean? That means that a stroke facility very tightly follows the American Stroke and the American Heart Association guidelines for the management of stroke. So when our paramedics in the field recognize a patient potentially having a stroke, they make that call to the hospital immediately and say, we have a stroke alert. When they activate a stroke alert, that brings all their resources together in the emergency department to include opening their CAT scan. Once the patient arrives, they're required to see the patient and be evaluated by the doctor in less than 15 minutes. They have to be on their way to CAT scan in less than 25. They got to have that CAT scan as soon as possible. Now, why the CAT scan? If you're having a hemorrhage type stroke, they can see that on the CAT scan. If you're having a clot type stroke, some type of an obstructive stroke, ideally, you want to come back with a normal looking CAT scan, but you have all the neural deficits that present as a stroke. And then you would benefit from some of the medications that can help break up that obstruction.
Right.
So patients that have the obstructed blood clot type stroke, it's so important to activate that stroke alert. That puts all the resources available at the local hospital. They get that quick CAT scan, and now the physician has that information to say, I do not recognize this as a bleeding stroke. This is not a hemorrhage. There's not herniation of the brain. I don't see brain injury. And they're a candidate for the thrombolytic medications that can break up those strikes.
Okay.
And the thrombolytic medications are designed to break up those clots and to restore blood flow to the brain. And it's critically important. There's a very short window of opportunity.
Right.
And in many cases, beyond 4 hours, the risks outweigh the benefits. So it's truly time dependent. So quick recognition, that immediate call to 911. I would much prefer to go out and evaluate a patient that someone believes is having a stroke, and we might find them to have, for example, low blood sugar, and we can treat their low blood sugar, rather than someone waiting or saying, well, maybe I'll call your primary care doc and see what he says. He's going to tell you to call 911, go to the emergency department.
It makes so much sense. The time that you've taken to look up the doctor's phone number or to find the
And then you get a nurse, and then the doctor's busy seeing patients, and they're going to tell you to call 911.
Right, right.
Call 911.
And you've lost already a few minutes there. And
time is of the
like
essence.
you said, if they know you're feeling like someone is having a stroke, you've made that 911 call, they're prepared at least to know what they're going to expect when they...
Our local hospital, Parkland, does a great job of managing strokes. You know, and it starts in the field. It really starts with that call to 911. That gets the resources to the patient as quick as possible, that quick evaluation and that quick transport.
Well, maybe if you explain some of the complications and the recovery of stroke, people will be more apt to act fast, because if they realize that that time lost, there's less chance of full recovery or some of the complications.
Excellent point. In the industrialized nations, we look at morbidity and the rate of disability. I would tell you that 15% of stroke victims end up in long-term institutions. That's 15%.
Wow. Yeah, and that's scary to think that
Absolutely.
we're losing
you lose your
time.
independence.
Right.
You lose your independence in a blink of an eye. 20% are going to require assistance with just walking. 30% are going to require assistance with the activities of daily life. So not only is it a burden on the patient, but now you're looking at families and caregivers or nursing homes. 70% the disabilities to the point that they can't return to the workforce.
Oh, wow. Wow, those are high percentages.
It's very high percentages.
Yeah.
You know, we recognize that many strokes, 30% of the patients will it would be a fatal injury for them. Others, as high as 30%, will have some pretty significant disabilities. 20% will have some moderate disabilities, and some patients can have some very mild disabilities. But there's some significant effects as a result of stroke. And again, it's so important to recognize risk factors and to try to modify those risk factors and take the steps early to help prevent strokes. And men, we have them early. Women have them a little bit later, but they're significantly more significant.
So if you've had a stroke, are you more inclined to have multiple strokes after that?
Statistically, you probably are.
Really?
And typically a patient that has a stroke, a good percentage of them won't live another 10 years. I mean, they'll probably go for 10. Right. So it's, again, all about the risk factors and preventing that first stroke.
Is there a website that people can go to for more information on?
The American Stroke Association is a division of the American Heart Association. It has some great information online. What I think is real important is have that conversation with your primary care physician and bring your concerns. I'm sure that they're monitoring your blood pressure, they're monitoring your blood sugar, they're monitoring your heart rhythm to ensure you don't have an abnormal heart rhythm. They're monitoring your lipids, and they're taking steps to help control. You have to be responsible for your own health and take those steps to improve your health and modify those risk factors. Right.
Remind our viewers about FAST. So that is the face?
Whenever you see any abnormal looking face, if their face is drooping, if they are unable to squint, and in some cases it can be very, very profound.
So even, so it's not always the mouth, it could be...
Correct, it could be in the eye. You may be the total side of the face.
Oh, okay.
I see it in their eye, I see it in their eyelid, I see it in their cheek. I'll try to have them smile, I'll have them crunch their forehead, and you'll definitely see a difference in one side or the other.
Okay.
Your family members, your peers, your friends, you recognize their face, but you can also recognize when something doesn't quite look right.
Right. Right.
And we're going to depend on our family and friends to help make that identification, because I might not recognize that going on personally. If you notice that there's any kind of motor weakness, if they look a little bit clumsy, they have an unsteady gait, they look like they could fall, they are having trouble maintaining their balance, that indicates maybe some motor weakness. If you say, Suzanne, what's the problem? What's the matter? And I recognize that you're having difficulty with your speech, or maybe having difficulty forming words, stuttering your words. Very slow speaking. I recognize that time is of the utmost importance, and we make that immediate phone call to 911.
So some of these symptoms can be occurring over time, like maybe over 24 hours, maybe before people recognize it, or is it a short, like, you know, there's a window of 10 minutes where someone experiences a stroke. Can it drag on to 24 hours?
It's very acute. When we have a blood clot, it's very, very acute.
Okay.
So they'll go, 1 minute they may look, they're talking to you and everything appears to be fine. You're not at all alerted by their appearance or their speech. And the next minute you notice their face doesn't look quite normal. Are you okay? And you notice there's some difficulty in speech. So what's the important thing to do?
Right.
I'm really concerned about you. I'm calling 911.
What if they're home alone and they've experienced a stroke, and when you come home later in the day, do those symptoms go away? I guess that's when
No, the symptoms unfortunately do not go away.
Okay, so you would know, so they don't come and go. You've had your little mild or mini stroke and things. Okay, well, that's important to know.
Think about when we have that,
yeah.
say for example, a blood clot. In the area affected, that blood vessel supply is probably initially like the size of a pea, but over the next several hours it grows to the size of a baseball.
Oh, wow.
It just extends and extends. So we have a lot of secondary injuries
so it
from that
doesn't
stroke.
stop. It just
Symptoms will probably
continue to
get worse until
Okay.
you're treated.
Wow. Okay, so we've got to remember fast.
We need to remember fast.
Definitely 911. I mean,
absolutely 911.
It's foolish to consider calling any other number when you're so prepared to treat.
One of the nice things about 911 that people may not know is that they have automatic number identification and they have address identification. When you call 911, before they even say New Hampshire 911, what's your emergency?
Right, they probably can call you by name.
They see your phone, the address of your phone, they see your location, they know what engine, what ambulance, what police, they know who to send to your house.
Right.
Without you even saying, you know, I need help. They see all that information. So for whatever reason you are unable to communicate, if you knew to call 911 but you had trouble with your speech, they would know to at least send the police. They're going to send someone. Every 911 call gets a response. If you were to call the fire department, we would have no clue. If we don't hear you on the other end, we don't know your location, where you're calling from. You call 911, they have that information, they're going to send us. It's a valuable tool. It's a very valuable tool for Derry.
Right, yeah. And we're so conditioned to call 911 in emergency. So even the smallest sign of stroke, people should call 911.
And we're more than happy to respond, to evaluate, to transport to the most appropriate facility. It's all about, you know, doing what we feel is best for the patients. And I will tell you that every one of the medics takes this so personally. They work very, very hard. They train very, very hard. They want to ensure that their patients get the best possible care.
Right. Well, with the, you said in the beginning of the show, 130 are treated or were treated, say last year. I mean, that's almost 12 strokes a month.
It's pretty significant.
That
it's
is
about
a
5%
lot.
of our call volume, believe it or not. It's
that's
4.5 to
a lot.
5%.
Wow, wow. Well, thank you for educating us on that.
You're entirely
It's
welcome.
been really helpful. I want to thank you for watching Get the Facts. I hope you've learned as much as I have today about the symptoms of stroke and how important it is to act fast. Once again, my name is Suzanne Bernier Robinson. Thank you for watching Derry Community Television.